So today I would like to talk about a fairly common topic that is bladder urgency. And this is a really common thing that happens especially to women, although it can happen to men as well. And it's often something that happens more and more as we get older. And there are a number of reasons why this occurs, but it can really be very bothersome. I try to talk about this because it's so impairing in many cases to enjoyment of life and kind of takes up a lot of mental space as women are working on figuring out how to comfortably live with this condition. So there are some things that are principles to keep in mind, and it's important because many of the ways that you manage this are really the opposite of what you would think are the right way to do things. It's very common that women will immediately find a toilet as soon as they get the urgency to empty their bladder, and they'll move in that direction right away. And that actually makes things quite a bit worse. And then they also have a tendency, when they're out and about at least, to maintain a dehydrated state because they feel that if I drink more water, that'll just make this problem worse. And that actually isn't true either. The typical prescription that doctors will give is the Kegel exercise. So I would like to encourage you to consider trying this if this is a problem for you. And there are other things that can be done too. We can add medicines that sometimes can be helpful if just the practice of the exercise isn't enough. So you needn't lose hope. It isn't a quick fix, but it can sometimes be a very good fix. Thank you very much for listening to this educational video. Please visit our website so that you can learn more from our other learning modules, and thank you for your attention.